Some pains are physical and some pains are mental, but the one that is both is dental. Good evening, friends. I am Meenakshi Sharma and welcome to yet another new episode of BMC Global Live AL-HILAL Health World, Nothing But Lifestyle. In this talk show, we have experienced and expert doctors with us to share their valuable knowledge because our priority is your good health. Dear friends, when we feel discomfort or unexpected pain while consuming hot or cold food and drinks, these are common symptoms of sensitive tooth. And people often they suffer too long because of this sensitivity because they think that it is not curable. But otherwise, it can be greatly reduced or eliminated as well. To throw more light on this topic, that is tooth sensitivity, we have with us in our studio Dr. Aysha Khalid Almohaisen. She is a general dentist. She has done her bachelor's degree in dental surgery from Ras Al Khaimah Medical University, UAE in 2019. She has done advanced courses in endodontics and operative dentistry. Previously, she was working in AlHILAL Medical Center, Seaf area, and now she is associated with AL-HILAL Hospital, Hamad Town branch. So, let's welcome her. Good evening, Dr. Aysha.
Hi, good evening.
And welcome to our show.
Thank you very much.
How are you?
Alhamdulillah, fine. How about you?
Fine, thank you. Doctor, we all know that if our teeth are strong and healthy, we enjoy eating anything. But when it comes to tooth pain or sensitivity, it becomes a nightmare. So to start our discussion, first of all, we would like to know what exactly is tooth sensitivity and why is it caused?
Tooth sensitivity, it is exactly what it sounds like, a pain or discomfort in one tooth or several teeth as a response to certain stimuli such as hot or cold drinks or temperatures. And we have two types of tooth sensitivity. We have a temporary and permanent tooth sensitivity. The causes for the temporary tooth sensitivity, it is expected after any dental procedure such as deep scaling or deep cleaning of the teeth normally, and after any dental fillings or after any external teeth whitening. This is for temporary tooth sensitivity. And for the permanent tooth sensitivity is the patient is playing a big role here. If the patient brushing the teeth so hardly, using a hard toothbrush, the patient is grinding at night, and there is some gum diseases that will cause receding of the gum. Once the gum will recede on its normal level, we will have an exposure of the root of the tooth. Once we have this exposure, the patient will experience tooth sensitivity. Some other conditions, acid reflux from the stomach, which will lead to acidic environment of the oral cavity. And once we have an acid environment of the oral cavity, the protective layer of the tooth will dissolve. Once we lose this protective layer, the patient will experience tooth sensitivity. Why? Because the second layer of the tooth will be exposed, which is called a dentine layer.
So this is like the permanent.
Yes.
So doctor, we would like to know, is this tooth sensitivity, it is a kind of infection or something else it is?
Not always, but sometimes yes. If the patient experience some decayed cavities, some chipped tooth, broken fillings, the patient will experience this, and the infection-related tooth pain is dull, continuous, sharp, and sometimes it's for a short period of time, and the patient can know on which tooth is the pain.
Okay, and can this tooth sensitivity be treated?
Yes.
So what are the like different ways in which it can
Yeah,
be treated?
we have two options. Either in office, the dentist can apply a fluoride gel to the affected teeth, and we will leave the fluoride gel for a few minutes. And in house, the first option is in office, and the second option is in house. The patient can use some certain toothpaste, mouthwash, and topical gels that the dentist prescribe it for the patient. And all these products are affecting as a desanitizing effect, giving a desanitizing effect for the teeth, which will block the pain or the discomfort from traveling toward the nerve or the pulp.
And how many times in a day, like the person should apply gel or the treatment which you are telling?
For the treatment, at least 2 times a day. Two times a day, once in the morning and once before bed. Yeah, to let the gel keep all the night. Yeah, this is for the gel. And for the toothpaste, as usual, brushing, how many brushing the teeth, like 2 times, one morning and one at night or after any meal.
Spoken about the toothbrush. So what kind of toothbrush we should use, like so that the enamel of the tooth should not.
Yeah, it is advisable to use a soft toothbrush, and it is not a very big, huge toothbrush and not very small, like a good size.
So it should be not very
Soft,
hard and not
soft.
very soft.
Yes, soft. Yes.
But not too soft.
Yes, not extra soft.
Extra
the soft only.
Yes, exactly. That's very interesting. And dear viewers, here we will take a very short break and we'll be right back. Stay tuned. Dear friends, welcome back again. And today we are having a discussion with Dr. Aysha on the topic tooth sensitivity. So moving ahead, Dr. Aysha, we would like to know that sensitive tooth pain is curable? Like, will it go away?
Yes, for some categories, yes. As I mentioned before, the first category of tooth sensitivity is the temporary. Once the tooth sensitivity is temporary, so it's after any dental procedure, fillings, teeth whitening, root canal treatment. It will go away by itself. It will subside after a few days.
And what if the sensitivity persists for long?
Okay, if the sensitivity persists for long, if the patient experience the acid reflux from the stomach, we can refer the patient to physician to treat the main problem. And if the patient grinding at night, we can offer a mouth guard or a night guard. And it's like a mold. The patient will wear it. It is a soft. The patient will wear it all night, and he will remove it in the morning. And if the patient have some gum diseases, such as receding, the gum will recede from its level, and once the gum it's receded from the level, we will have an exposure of the roots. We can offer, in this case, a gum graft. We can do a surgery for gum grafting in that tooth, affected tooth. And if the pain still persists, we try all other means of treatment, and still we failed, and still there is sensitivity or discomfort. We can do a root canal treatment for the affected tooth, which we can kill the nerve and the pulp there, which is causing the discomfort or the pain for the patient. But see, this is the last treatment option. Yes.
As you just now mentioned about the night guard, so is it comfortable for the patient to wear it at night?
Yes. It is. It is very soft. The patient can wear it, and he will not feel it at all. Yeah, and he can sleep safely.
So how to prevent tooth sensitivity so that one should not have this?
Okay, we can advise the patient to do brushing at least 2 to 3 times a day, flossing using the floss, the dental floss. It is very important to use a dental floss to remove the food impaction of food particles from between the teeth, and to use a mouthwash, and also to use a fluoridated toothpaste, which contain a fluoride ingredients in it, which will strengthen the enamel layer. And avoid consuming too much acidic foods and drinks.
One thing, our audience would like to know, this night guard needs to be cleaned, or because morning, daytime, maybe they will not wear, only during the night they will be wearing. So how we can maintain the, you can say, the cleanliness of this night
We
guard?
can use same mouthwash that the patient using for himself. We can use the same mouthwash to wash the night guard or the mouth guard, and we can keep it in a safely box. The dentist will provide a small box to save this night guard.
And how many times a person should do mouthwash in a day?
In a day, at least 2 times. It will be enough. Yeah, but for brushing, it's very important to brush after breakfast, lunch, and dinner.
So it means 3 times the person should.
Yes.
Before we conclude our today's episode, what advice would you like to share with our audience, those who are suffering from tooth sensitivity problem?
A proper oral hygiene is the key to prevent any tooth pain or sensitive tooth pain.
That's a very good advice, and I'm sure our audience, they will follow the advice and guidelines given by you. Thank you so much, Dr. Aysha, for coming here and sharing your expert advice with our audience. Really, we are really grateful to you, and thank you once again. Dear friends, always address even a mild pain or sensitivity when it first begins. With this note, this is Meenakshi Sharma signing off for this evening. Till we meet next week, same day, same time. Take very good care of yourselves and your loved ones. Stay safe, stay healthy, stay strong. Good night.